I'm Salwan Al-Mutar, a medical oncologist specializing in gastrointestinal cancer. In this video, you'll be provided with educational information regarding the chemotherapy abbreviated as Folfirinox. Folfirinox stands for 3 chemotherapeutic agents: 5-fluorouracil, oxaliplatin, and irinotecan. You will also receive an infusion of a drug called leucovorin, which will help make 5-fluorouracil chemotherapy less toxic. These infusions will be delivered through a catheter that is connected to your bigger veins called the port. They will be delivered every 2 weeks at one of our infusion centers in Dallas, Richardson Plano, Redbird, or Fort Worth. 5-fluorouracil chemotherapy will need to be administered slowly. You will be connected to a pump that will be programmed to give you this chemotherapy over 46 hours. We will teach you or your caregiver how to disconnect yourself at home. If you do not feel comfortable, you will be provided with another appointment for pump disconnect. If you do feel comfortable, you will be provided with flushes to help flush the catheter after disconnecting the pump. Once you disconnect the pump, the cycle is concluded. You will repeat the same cycle 2 weeks later. Before every infusion, you will receive follow-up labs and will be monitored for response with tumor marker if applicable. You will also receive scans on average every 2 to 3 months to best evaluate your overall response to treatment. Everyone reacts differently to potential side effects. Some of the most important side effects noted with this regimen include, but are not limited to, fatigue that might last up to 3 to 4 days, nausea, and vomiting. You will be provided with IV medications to prevent this, as well as oral medication to take at home as needed. You may also experience diarrhea and abdominal cramps after chemotherapy. To prevent this, you will receive an IV medication called atropine. You will also be provided with a prescription for an over-the-counter medication called loperamide, also known as Imodium, which can be used as a first-line tool to address this issue. You may take loperamide up to 6 times a day if needed. If your starting medications do not work, we will provide you with further medications. Mouth sores might also develop, and you will be provided with mouthwash if happened. This chemotherapy may also affect your liver, kidney, blood counts. If we noted that your white blood cells are low, we may consider additional injection to increase your count. Though you may not feel some of these issues, we will closely monitor you and your labs and make adjustments accordingly. Decreased appetites over a few days, as well as change in taste, is anticipated to last for a few days. Hydration and high protein intake, as tolerated, will be important during that time. One of the chemotherapies, known as oxaliplatin, can give you a sensation of pins and needles, which is usually triggered by cold. This is known as neuropathy. You will be advised to avoid touching or drinking anything cold for 4 to 5 days. We will monitor you closely for the duration and the intensity of these symptoms, for which dose adjustments can be considered accordingly. It is important that you monitor your body temperature. A fever of 100.5 degrees or more can be a sign of worsening infection, which will require an immediate visit to the emergency room to check your blood count. If your blood count is too low, antibiotics will be given to avoid worsening infection. There is a low chance of an infusion reaction. This can sometimes be mitigated, but will prolong the infusion. We will monitor you closely for any signs of allergy, such as shortness of breath, hives, or change in blood pressure that produces lightheadedness or dizziness. Another rare side effect that may occur is chest pain, which can happen due to abnormal contraction of the blood vessels of the heart, called vasospasm. If you experience this, please go to the emergency room immediately to rule out a real heart attack. Communication is key in getting a better control of your side effects. Please do not hesitate to contact us, as if you have any issue or question that are not addressed in this video, or if you have any other issues related to your prescribed medications. Thank you. We wish you a safe and successful journey with your treatment here at UT Southwestern.